Hello, ladies and gentlemen. My name is Danielle Chiaro, and today I will be presenting two experts to speak on the pros and cons of treating anxiety disorders with benzodiazepines. The information contained in this presentation will be a supplement of the information that can be found under the tab Expert Opinions on my website. To develop my topic for review, I first read the article, Research Area of Emphasis in Professional Psychology, Past and Current Trends. I decided to focus on ethical issues in treating anxiety disorders. My initial topic involved the pros and cons of treating panic disorder with benzodiazepines. Why is this important, you might ask? Well, benzodiazepines are commonly prescribed to treat anxiety disorders. They are often the first and only form of treatment people receive. Unfortunately, benzodiazepine use can lead to patient reliance and even addiction. Two questions I want to answer today. Are benzodiazepines the most effective form of treatment for anxiety disorders? And should benzodiazepines be used in combination with cognitive behavioral therapy? My experts today are Dr. Megan Keogh and Dr. Peter Royburn. Dr. Keogh has a PhD in clinical psychology and is a licensed clinical psychologist. Dr. Royburn has a medical degree in psychiatry and is a practicing psychiatrist. Both doctors are professors at the University of Washington in Seattle. Both doctors specialize in mood and anxiety disorders. Dr. Keogh specializes in using empirically supported treatment modalities for the treatment of anxiety disorders. Dr. Royburn has extensive research focused on anxiety disorders and on benzodiazepine use for the treatment of anxiety disorders. In her practice, Dr. Keogh strongly advocates for the use of cognitive behavioral therapy for the treatment of patients with anxiety disorders. In her research, Dr. Keogh has focused on anxiety-sensitive people. She has come to see that people with anxiety disorders tend to self-medicate. This was evident in her and fellow colleagues' 2007 study, Anxiety Sensitivity as a Prospective Predictor to Alcohol Use. Dr. Keogh does not oppose initial low-dose benzodiazepine use. Dr. Keogh's research and experiences have shaped her opinion that therapy and psychoeducation, or the educating of patients on their symptoms and how to deal with these symptoms, increase long-lasting positive treatment outcomes. I found two articles that align with Dr. Keogh's views. According to the 2013 article, Drug Treatment for Anxiety, short-term benzodiazepine use in combination with cognitive behavioral therapy garner the best patient outcomes. Benzodiazepines should not be the first and only form of treatment for anxiety disorders. My quote presented here from the 2010 article, Usage of Benzodiazepines, a Review. The use of benzodiazepines in the long term is a very common phenomenon. Apologies have been put forward for the continuing prescription of benzodiazepines despite official exhortations to limit their use. These articles support Dr. Keogh's opinion that people with anxiety disorders run the risk of substance abuse. Therefore, therapy, specifically as advocated by her cognitive behavioral therapy, rather than benzodiazepines, should be used for the treatment of anxiety disorders. According to her associate profile on psychiatrymedicine.com, Dr. Keogh has a professional relationship with the National Institute of Mental Health, otherwise known as NIM. She even received funding for her research on anxiety disorders from this organization. Dr. Keogh would recommend this website for those who have anxiety disorders or know someone with anxiety disorders to further their knowledge on how to treat these disorders, what symptoms are, and how to manage these symptoms. In 1991, Dr. Royburn and Deborah Cowley published a book entitled Benzodiazepines in Clinical Practice, Risks and Benefits. At the time of its publication, it contained the most current information on the therapeutic uses of benzodiazepines. Dr. Royburn advocates for the use of antidepressants to treat anxiety disorders. Unlike Dr. Keogh, he does not support initial low-dose benzodiazepine use in the beginning of treatment. This is because Dr. Royburn feels that patients may become too reliant on benzodiazepines, so why even bother starting them on the drug, even for a short period of time. He understands that benzodiazepines do work effectively for reducing anxiety symptoms. However, because they do work so effectively, patients may be less likely to follow through with antidepressants and therapy, or a combination of the two, because those treatments take longer to take effect. However, these forms of treatment, he feels, garner longer-lasting positive treatment outcomes for the treatment of anxiety disorders. Dr. Royburn and his colleagues developed the Coordinated Anxiety Learning and Management, also known as CALM program. This program was developed by Dr. Royburn and his colleagues when they started to notice a trend in people receiving treatment for anxiety disorders and depression from their primary care physicians. This happens for a variety of reasons. It could be that an individual is embarrassed and does not want to go to therapy or see a psychiatrist, or it could be that their insurance policies do not cover that sort of treatment. What CALM does is seeks to accommodate the complexity of real-world clinical settings while maximizing fidelity to the evidence base in the context of a broad range of patients, clinicians, practice settings, and payers. According to the 2006 article, Benzodiazepine Use, Abuse, and Dependence. Although benzodiazepines are invaluable in the treatment of anxiety disorders, they have some potential for abuse and may cause dependence or addiction. Long-term use of benzodiazepines may cause physical dependence. This article supports the views of Dr. Royburn. According to his associate profile on psychiatrymedicine.com, Dr. Royburn is associated with Anxiety and Depression Association of America. He has often been a guest speaker for this association. Dr. Royburn would recommend this website for people to further their knowledge on anxiety disorders, symptoms, and treatment options. If we take my experts and compare them side by side, we can see that they have various views on how to treat anxiety disorders. However, the one important thing they do agree on is that long-term benzodiazepine use should not be utilized. In summary, my original questions were: are benzodiazepines the most effective form of treatment for anxiety disorders? And should benzodiazepines be used in combination with cognitive behavioral therapy? Throughout this presentation, the use of articles and my experts, those questions were answered. Benzodiazepines should not be the front line of treatment for anxiety disorders and thus panic disorder. Long-term benzodiazepine use can lead to addiction and/or symptoms of withdrawal when the medication stops. Lastly, antidepressants, cognitive behavioral therapy, or a combination of the two are a more effective form of treatment for anxiety disorders than benzodiazepines. Thank you for your time, ladies and gentlemen. I hope you have enjoyed this presentation. Coming up for you, I have my reference slides, And lastly, my websites that my experts are associated with, in case anyone would like to take the opportunity in their own time to peruse the sites and further their knowledge on this topic.